Talking about the emotional side there, sometimes there's a danger things are slightly overlooked or other things take priority. What was your experience of the aftercare in your case?
As stated before, I literally was sent out of hospital on the Monday morning and I was put in the care of my GP, but I had there was no district nurse, no other aftercare. And I actually wasn't seen by my consultant until 14 weeks after surgery. So, that seemed one heck of a long time. And even though you've been put in the care of your GP, it takes a lot of energy. You really get to a bad place before you actually make that phone call. I think it's just the way these days with trying to get through to your GP, trying to get an appointment. Although I did find they were okay when I did need them.
So of all the symptoms you were getting then, it was the emotional ones you were struggling with, is that right?
Mainly, yeah. I think there was I did have some discharge for a number of weeks afterwards, and my GP did reassure me that it was quite normal. It does take, you've got all the internal healing, so that has to find a way out. And that was quite, that reassured me.
Given that there was a slight delay in attending to your emotional needs, is there a way we could deal with things better in terms of how healthcare is organised?
It's maybe GPs need to be aware that we're not just physical bodies, that, the emotional side is really important, especially when you've had a cancer diagnosis and a hysterectomy. I think certainly as a woman, it's quite an emotional thing to go through as well. It's not just it's not just physical.
Even in hospital, 70% of emotional needs are attended to by the frontline cancer nurses, as opposed to any hospital mental health specialist or psychologist. It's rare for them to have a specialist unit like ours. You were eventually referred to our service, psycho-oncology. Although not everyone has that, do you feel that's ultimately a benefit? Something that other areas should develop?
Yeah, I think definitely. I think, I've found it really, really useful. I've only had a couple of appointments, 2 or 3 appointments, and I actually feel I've come on leaps and bounds really. And I wish I could have been referred maybe a year previously.
It would be nice in a way if we offered something in broad terms acceptable to people, but simple enough for them to access, that was still helping them emotionally as well as physically. Sometimes there's a gap physically, sometimes there's a gap emotionally. Ideally we should plug both those gaps so there's no unmet needs.
Yeah, I think I think there are people who maybe with a cancer diagnosis, they literally have the surgery, they want to put it behind them, forget about it and get on with their lives, but I personally feel you need to deal with it there and then. I just feel if it's put away, it'll only come back a few years down the line and maybe in some other way.